Hello, my name is Preety Khanna and I'm presenting my scholarly project, Decreasing Patient Waiting Time to Increase Satisfaction in the Gastroenterology Clinic. The committee members for this project is Dr. Hoppner, who's the DNP chair, Dr. Snell, who's the second reader, and Dr. Maprel, who's the community chair for this committee. Let's talk about the background and the significance. The research question is, would implementing Lean Six Sigma strategies reduce the patient wait time and improve patient satisfaction at the gastroenterology clinic compared to not introducing Lean Sigma strategies? The project aims at reducing the time the GI patients takes before they receive medical attention through the application of the Lean Six Sigma strategies. Additionally, the project also envisages that reducing the wait time for GI patients will increase their satisfaction levels. The weighted given The project focuses on the model's flexibility to allow metric adjustments while leveraging technological solutions to provide essential services to the patients. Patient satisfaction. There's often a long wait time to see a provider in specialty clinics, which contributes to poor patient satisfaction. The challenge impacts the GI clinic on the West Coast. Evidence shows that patients are likely to be dissatisfied in their wait time is within 30 minutes. And there's an inverse relationship between wait time and patient satisfaction. Wait time. Long wait times limit the healthcare provider's ability to provide the proper care at the right time and they're standard products of an inefficient workflow. Like the GI clinic, specialty clinics need to be proactive and implement LSS strategies to decrease wait times and improve patient satisfaction. Quality of service. Although long wait time in the outpatient clinics may not contribute to adverse outcomes, they strongly indicate the quality of service and patients' dissatisfaction. Patients consider untoward waiting time a waste of time or idle time resulting in frustration. Let's review the literature. Long wait time. GI clinic is a busy specialty. Given the prevalence of GI issues among patients, it impacts patients' experiences with the clinic. It is therefore essential to improve patients' experience and satisfaction with outpatient clinics to maintain adherence to follow-up. Reducing the wait time. Improving the patient flow in outpatient clinics by reducing the wait time is imperative, especially during the pandemic, to reduce infection, transmission by facilitating quick patient flow across the clinic. Healthcare professionals must find innovative solutions to reduce the wait time. It is a critical quality indicator in the clinics. One of the most applied strategies to improve the quality of care in the health clinic is the Lean Six Sigma strategy. The DNP project used the LSS strategy to reduce clinic wait time at the GI clinic. Let's talk about the framework. We use the Donovan Quality Framework for assessment. Frameworks strengthen the implementation and they allow the critical evaluation and replicating of processes in the future. The DQF framework, it is a quality assessment tool that measures the endpoints of the project and it also allows the assessment of process indicators critical to any quality improvement project. The components. According to DQF, the quality of care is the extent of degree to which it enhances the probability of the desired outcomes. It stresses adopting valid and reliable measurements to evaluate the structure, processes, and outcomes of three core elements of the framework. In this project, the DQF used to assess the processes and outcome variables related to the wait time. Structures refers to the physical characteristics of the facilities. It includes the staffing, human and material processes, policies and procedures, services, and clinical guidelines guiding the process within the facility. The process entails intervention deployed to improve quality outcomes, such as Lean Six Sigma approach, and the outcomes are the hypothesized quality measures, such as reducing wait times. How does it all fit? Well, DQF also states that a support structure is a prerequisite for the success of any implementation. The process entails interventions deployed to improve quality outcomes, such as the Lean Six Sigma approach. The outcomes are the hypothesized quality measures, such as reducing wait time. DQF also states that a support structure is a prerequisite for the success of any implementation. Let's look at the method and design. A quasi-experimental pre and post design was used for the study. The design used a mixed method approach within an LSS framework to evaluate the impact on average patient cycle time before and after the intervention. The patient satisfaction survey and the patient visit tracker form was utilized to compile the data for the study. The study comprised of 220 adult patients in the clinic between January the 15th and March the 15th of 2023. The pre and the post-test scores were evaluated to determine if the clinic waiting time had reduced and the patient satisfaction scores improved post-intervention. No patient information was abstracted from the electronic medical records. The EMRs from the clinic were utilized for only data collection. The student recorded the minimum necessary data to accomplish the project's goals on the data collection sheet. All the patient identifiers were removed and not collected for this project. After completing the baseline assessment and exploring the root causes, 3 or 4 staff meetings with the stakeholders were held. All brainstormed the possible solutions to the root cause of the delay and its implementing strategies. Some strategies implemented included pre-registration of the process, maximum utilization of the clinic structure, stopping unbooked ad hoc patient registration, rescheduling staff break time, and keeping a reasonable time duration for each patient according to their primary complaint. All these strategies were shared with the stakeholders and the clinic administration. Staff also brainstormed the best ways to implement these strategies step by step. The implementation phase took about 4 to 6 weeks. This is the power analysis, and this table depicts the results of it. Now we're going to look at the data analysis of the project. The initial intention when making the plan for data analysis was to use the independent samples t-test. One assumption is that the dependent variable, that's doctor duration, must be normally distributed. The Kolmogorov-Smuller normality test and the Shapiro-Wilk normality test was completed, and both found significance. P-value was less than 0.05 for each group, the post group and all doctors' duration. This violates the assumption of normality. A Mann-Whitney U test was completed, the non-paramedic equivalent for the doctor's duration. The result of the Mann-Whitney U test has a significance of 1.000, more significant than 0.05. The test shows a significance of 0.000, but since the results were in the wrong direction, pre-doctor duration was less than the post, we take 1 minus the significance to find the p-value for our test. The p-value would be 1.000, which is greater than 0.05. The post-test was not found to be significantly less than the pre-test. Let's look at the results of the histogram of the pre and the post-doctor duration. The initiatives implemented by the GI clinic reduced the wait time and improved patient satisfaction as evidenced by the statistically significant difference in the patient scores before and after the intervention. A Mann-Whitney U test was also completed for each of the satisfaction scores. There was a significant difference in the better for time between making appointments and being seen, time in the waiting room, and time in the exam room. All three had significant scores of less than 0.05. Let's look at some of the limitations that we had for the project. The critical limitation of the systemic is the high heterogeneity among the studies included in the review. Heterogeneity related to the sample and the design of the study limited the possibility of running a meta-analysis of the data. The authors provided a descriptive summary of their findings. Also, both reviews provided a high risk of bias among the included studies, which followed the study design throughout a comparison group. Although having a comparison group enhances the methodological rigor of a study, a pre-post design suffices when the research question can better be answered following a study design without a comparison group. Moreover, intervention studies are also subject to the Hawthorne effect, where subjects are likely to respond positively because they participate in the study. To overcome these biases, studies collect objective data to reflect the magnitude of the effect supplemented by subjective inquiry. Another critical implementation highlighted by some studies are limiting the scope of the study to single settings and a small sample, and a lack of diversity in perspective, further limiting the generalization of the study findings. According to Polkenbuck 2020, if a large sample size enhances the credibility of a quantitative study, diversity in the sample strengthens the findings of the qualitative study. A small sample was also a limitation in studies where the response rate of the post-intervention survey was lower than the pre-intervention, thus affecting the statistical analysis of the data. Also, the lack of uniformity in data, collective methods, before and after the intervention was a critical limitation in some studies. For instance, a study failed to collect patient perspectives pre-intervention. Similarly, it also failed to measure the measurement cycle post-interventions. It is also acknowledged that manual recordings of patient checkout times may have induced human errors in the accuracy of the data recordings. Another critical implementation highlighted by some studies was limiting the scope of the study to single settings and a small sample, and a lack of diversity in perspective, further limiting the generalizability of the study findings. Despite all the methodological or content-related limitations, there is a consensus among the researchers that the data-driven Lean Six Sigma approach nestled with the problem-solving strategies helps identify and address the root causes of the service related problems and addresses them. The primary unintended consequences experienced during data collection was the front office clinic staff turnover and the need to conduct more staff meetings to discuss the implementation of the LSS strategies. Implementing LSS requires the participation of the management and the staff to make the necessary improvements or changes. Despite the effective implementation of Lean Six Sigma in various outpatient clinics, some healthcare staff had also concerns about the execution process and about the change in the organizational culture and failure to recognizing the need for change as it could burden them significantly. Let's have a discussion on the findings, interpretation, and recommendation. The findings demonstrated that LSS framework to sustain the value-added services, shorten the cycle time during a clinic's visit without compromising the quality of care. These findings are not unique to the scholarly project. The results of this scholarly project both strengthen the current evidence and lend support to need for a change in current practice. The initiatives implemented by the GI clinic reduced patient wait times and improved patient satisfaction as evidenced by the statistically significant difference in the satisfaction scores before and after the intervention. The analysis of the data provided evidence that the interventions had a positive impact on the post-intervention ratings, establishing a correlation between modifications made to the processes and the systems ensure that the desired outcomes or process metrics experienced enhanced over time, thereby leading to improved future outcomes. The recommendations. The Scholargy project justified the implementation of the LSS framework in identifying and addressing operational inefficiencies, optimizing workflow processes, and enhancing the overall clinic performance, improving patient satisfaction. Aside from the effectiveness of the LSS framework, the findings also lead to the conclusion of the significant role of continuous process improvements. Collaboration and stakeholder engagements are also an essential components of process improvement programs, necessitating the active involvement of healthcare practitioners, administrative personnel, and patients. Implications for practice, for future research, healthcare policy, and qualitative safety. LSS framework can provide a better experience to patients, thereby enhancing their satisfaction. With such a positive correlation, implementing the same framework may be explored in other clinic settings and as it can effectively address the same concern. Future research should also explore the sustainability and the efficiency of the LSS framework in various healthcare settings outside of the GI clinics. The healthcare sector has made numerous attempts to focus more on the patient through its quest for increased patient satisfaction. With this reality, employing diverse process improvement techniques was essential in achieving substantial and sustainable patient outcomes. Factors such as scheduling, patient management, and clinic layout are some specific items that may be useful in implementing the same framework or any other policy within the healthcare provider settings. Collaboration is crucial in ensuring that initiatives effectively contribute to the clinic's improvement and address patient and staff concerns. The quality of treatment offered by medical staff, the environmental cleanliness and calmness, and the briefness of the patient waiting times are only of the few markers used to calculate patient satisfaction. In conclusion, this project provided valuable insights into utilizing the LSS framework within a gastrointestinal clinic settings. This implies that using the framework can provide a better experience to patients, thereby enhancing their satisfaction. With such a positive correlation, implementing the same framework may be explored in other clinic settings, as it can also effectively address the same concerns. Aside from the effectiveness of the LSS framework, the findings also lead to the conclusion of the significant role of continuous process improvement. Therefore, clinics must implement regular and comprehensive evaluation of the operational procedures. The data reveals some of the difficulties encountered by the patient that the management could have better addressed. The delivery of care of superior quality may then be provided to patients if there's an ongoing enhancement based on verifiable and reliable evaluation results. My time in the Merivale DNP program has been both rigorous and worthwhile. It has helped me become a better advanced practitioner, equip me to better my patient outcomes, and has filled my family with pride in me. And if you have any questions, feel free to contact me on my email, which is pkhanna1@live.merivale.edu. And thank you for your time to listen to my presentation. And these are my references. Thank you very much.